afternoon, everybody. We are here at LINNC Online at LINNC Americas in Miami, 2024, and we have a very special guest. Is Dr. Orlando Diaz from the Methodist Hospital from Houston.
Okay.
Good afternoon, Orlando.
Thank you very much. I'm very happy to be here, enjoying and learning from the master. This is a great meeting here, and I invite you guys to come and be part of actively of this type of conference.
We would like to know about your experience in stroke and what you think it's the goal that we should do in the next years in South America or Latin America, transferring the experience from the United States to Latin America.
So it's a very interesting question. By the way, I'm going to be talking about this subject in the World Federation Congress of Interventional Neuroradiology in New York. But I think the number one point that we need to emphasize is education. We need to start educating the patients, the people, medical student, emergency doctor, because time is brain. So we need to expedite the process. I think the most important is to promote this, to teach the patients, to teach the doctors, to teach the medical student that this is a procedure that want to save life. Everybody have in the family a patient with have had a stroke in the past, and it's a very limited patient. There is a lot of difficulty for the family. So we need to start educating people from the ambulance standpoint, for the medical student, from the neurologist, to know that we can offer this again, 1A evidence for this. This is unbelievable.
And do you think who should be in charge of this education? Is the government? Is the doctors? Is the industry? Is it a combination?
I think it's a combination, but I think the government has to start the process. You know, we need the government has to promote this at the hospital, to have the material, to have all the devices that we need, to the ambulance, the the ambulance system in U.S., we give training to them to see where to take the patient with a stroke. What is the hospital that they have mechanical thrombectomy capability? So I think it's everybody, but I think it has to start with the government. Of course, medical student, emergency doctor. Sometimes the patient is coming with a facial palsy, and they say it's a peripheral facial palsy, send the patient home. So we need to be aware of the symptoms. So I think everybody, it's an effort. To me, education, information is the main point. It's easy to get a clot. It's easy. There are multiple devices. There are multiple catheters. Every time it's getting more and more. It's becoming easier every time. So I think the point is not the capability to get the clot out. The point is to educate the people.
And how do you foresee the next boundaries of SOF? Where we should go and then in terms of treat them?
Timing. We need to decrease the time of where we are doing. Now the extended window, every time we're doing more and more cases because it doesn't matter, you know, if the patient have the time was 6 hours, now this extended more and more. So, and before there was also the limitation of the size of the stroke already. Now it's not. So I think it's training people get to do this one, even though it's a relatively easy procedure, has to be trained. Go to the hospital, they have all the infrastructure. And remember, it's not only to take the clot out, this is what happened to the patient afterwards. So one of the boundaries is economical limitation, education, information, promoted in the TV shows, promoted in medical school.
So you're working now in Houston, but you are from Colombia.
Yes.
How do you see the difference in from Houston to Colombia or other similar countries in Latin America?
Definitely, there's all the 1A level evidence of the big 5 paper that have been published, made in U.S. the hospital to train to implement this. In Colombia specifically, it's very slow. There is no money because those materials are relatively expensive, and also there is not enough doctors doing this. So we need to train people. We need to open the capability to do that. I think this is the most important.
Dr. Diaz, thank you very much for your time.
It's a pleasure, Rodrigo.